San Francisco is giving homeless people alcohol to solve their problems. The experts insist that it works, but is this a good use of taxpayers' money? Welcome to America Uncovered. I'm Chris Chappell. Well, folks, San Francisco's back at it again. The city's giving homeless people free booze. Yes, you heard me right, free booze. Free booze to the homeless. Because whenever I see a homeless person passed out on the streets, the first thing that comes to my mind is somebody ought to give this guy a shot of vodka. So what exactly is San Francisco doing? Well, city nurses are giving participants the equivalent of 1 to 2 drinks 3 to 4 times a day. The doses can come in the form of vodka, liquor, wine, or beer. Stop and think about that for a moment. 1 to 2 drinks of vodka 3 to 4 times a day. I don't think that's good for your liver, whether you're an alcoholic or not. Also, nurses giving out alcohol as a remedy? What is this, a civil war? He's missing a leg? Get him lit! This program isn't anything new. San Francisco set it up 4 years ago during the early part of the pandemic because officials were concerned that quarantine mandates would prevent access to alcohol and lead to withdrawal, which can be quite life-threatening. I really can't blame them. 2020 was enough to make anyone want to get drunk. This rather unusual approach to alcohol addiction is based on a concept called harm reduction. The idea behind harm reduction programs is acknowledging that some people will keep using drugs and alcohol no matter what. So instead of pushing for abstinence, these programs focus on reducing the potential harms that could come with substance abuse. What it really comes down to is the same idea of promoting the safe consumption of hard drugs like fentanyl. And how successful was this idea? Come on, this is San Francisco we're talking about. If you think it worked, you might be drunk on taxpayer-funded booze. For alcohol in particular, this approach is part of what's called a Managed Alcohol Program, or MAP, as a way to care for homeless alcoholics. Proponents of MAPs point to similar programs in Canada, Portugal, and the UK. But shockingly, no free booze in Ireland. Way to fight stereotypes, Irish. They say the programs in these countries provide stability and support to the homeless. After all, according to this 2022 study, Canadian MAPs reduced the risk of death and resulted in fewer hospital stays for homeless alcoholics. This other 2022 study saw promise in MAPs and concluded that Scotland should invest in them. Was this study conducted by alcoholics in kilts by chance? As for San Francisco, according to a professor who helped create MAPs in San Francisco and Alameda County, the goal is eventually to help homeless people start figuring out what's next. Yes, I'm sure alcoholics having perpetual access to free alcohol 3 to 4 times a day will start figuring out what to do and then eventually do it. This is enabling, it's empowering. Yep, so empowered. And experts say it helps keep people off the streets and out of emergency rooms, jails, and the morgue. As evidence, San Francisco public health officials argued that over a 6-month period, the city saved $1.7 million in reduced calls to emergency services, including emergency room visits and other hospital stays due to their MAP. They also said that in the 6 months after clients entered the MAP, visits to the city's sobriety center dropped 92%, emergency room visits dropped more than 70%, and EMS calls and hospital visits were both cut in half. Wow, that all sounds pretty great. And if you're concerned that this won't exactly help people get sober, well, then you're missing the whole point. Remember, these programs don't focus on sobriety, but rather on improving participants' overall health while decreasing hospital stays and calls to police. In fact, they want a safe level of intoxication.
We do this in a residential setting, and the goal is to help clients achieve a safe level of intoxication to mitigate the harms related to overintoxication and binge drinking.
A safe level of intoxication? What, just drunk enough to do karaoke, but not drunk enough to pick a 9-minute Meatloaf song? For completely obvious reasons, San Francisco came under fire for this particular approach to homeless alcoholics. It's on fire both figuratively and literally. Maybe giving them flammable liquids isn't the best idea. As I said, while San Francisco health experts have claimed their MAP has reduced harm from alcohol, it makes one wonder, is this really because of their MAP being so effective, or were there other factors, such as, say, the elimination of COVID lockdowns? Wouldn't that also have had a huge effect on alcohol consumption and harm reduction? Whatever decrease was spotted probably had less to do with the map and more to do with San Francisco simply sending homeless people away without even knowing where many of them ended up. Considering how often California keeps trying the same thing and expecting different results, they're either insane or hopefully at a safe level of intoxication. But what about the numbers? What about the decrease in emergency room visits? Isn't that worth the $5 million a year they spent on this program? $5 million a year buying people booze. Wow, San Francisco, you know how to party. Well, it probably didn't have anything to do with this program because there was a grand total of 55 people in the program over 4 years. Let's do some math. If we assume that San Francisco spent that much each year over the past 4 years since the program began, and they served a total of 55 patients, it would seem that San Francisco spent over $363,000 per person to give them a few drinks a day to reduce harm. Wow. I'd say take a shot every time San Francisco implements some boneheaded progressive policy, but then we'd all be dead. Just like several of the participants after leaving the supposedly successful program. Wow. Wow. But don't worry, these officials are hoping to get some costs reimbursed through Medi-Cal, California's Medicaid program. Clearly, this isn't working for San Francisco. Even San Francisco Mayor London Breed, who had campaigned on safe injection facilities, is now blaming harm reduction for surging drug overdose deaths. Wow, it's refreshing to see a politician admit when they made a mistake. Is what I'd be saying if Breed actually admitted she made a mistake. Shockingly, just serving 55 people over 4 years a bunch of drinks isn't really putting much of a dent in San Francisco's homelessness problem. If you really want something that works for many and is much, much cheaper, why not Alcoholics Anonymous meetings? They're completely free. Nah, too common sense for these politicians. If you don't want America Uncovered to be out on the streets addicted to alcohol, like, subscribe, and share these videos with your friends. And since I'm not making enough money on YouTube to fund this show, I need your support on the crowdfunding website patreon.com/AmericaUncovered. All it takes is $1 an episode. I usually make about 12 episodes a month, but if that's too much for you, you can always set a monthly limit. You can even help me uncover America for just $1 a month. Don't worry, we won't squander millions of dollars on booze like San Francisco. Just click on the orange button to support this show. And if you didn't know, I also talk about news and politics and philosophy through the lens of gaming on my new show, Deep Thoughts While Gaming. Many on the far left will say religion is evil and should be banned, but they considered the evils of science. I talk about that in a video about Minecraft. Check it out. Once again, I'm Chris Chappell. Thanks for watching America Uncovered.